Mark Alves, very nice to meet you. And Dr. Gina Hall.
Hi,
And it's going to take you through some of the data from the million conversations. Yeah, it's a very different, isn't it? It's very different, isn't it, from a clinical, from a clinical data set. Yeah, yeah, and how we talk about, particularly for children, things that might be worrying them, so that you get ahead of the anxiety that comes from the anticipation.
So have you been growing how to capture data behind the scenes since you've launched?
That is some of what we've learned already, and then some future plans.
And 1 in 3 are children of school age, which is
so
just staggering, actually.
And what is it that you think that Chat provides that's so appealing, particularly to young people?
Well, I think intuitive as well. I think
Fill in forms.
And I think just the fact that it's 24/7 sort of.
And it's great that you've reflected that also in the volunteers that are signing up, which is really
that's right.
diverse.
Diversity
And also
there as
the
well.
number of young people volunteering.
Yes. So Mark's going to go through some of this, and then I thought we'd round off by just sort of talking a bit about potential.
We had these kind of notable events which have led to big increases in activity, and we really saw that most clearly over the pandemic, when the government announcement led to these big increases in people contacting us. We also see that the most common issue that people are coming to us about,
I know when I last visited.
so 10 p.m. to midnight is the busiest time, 7 days a week, and that's actually not all of our tests, is lack of sleep and mental health and mental health and sleep, both directions.
And is this very similar data to others working and collecting data across sort of mental health?
So one of the other things that we've clearly learned over the last year or so, clearly it's important interplay with young people. They're on their phones at night when they should be asleep, and then often on social media, and then they're hearing about us and then they're contacting us.
This is Nisha, one of our clinical supervisors. So our clinical supervisors support our volunteers kind of in real time on the platform. So Nisha's just going to show you the platform.
And am I right in thinking not many people are physically on site here? You're all
Correct.
from home and doing
That's right.
patterns.
So we all are dotted around the country. Yeah. This here is a list of all the volunteers that are currently on at the moment. So we've got them in different levels. So depending on how many conversations and hours that volunteers take, they move up the levels.
Are you always feeling like you need to have more people available?
And see who we can, if things come up unexpected. So this is our current queue.
And looking at this as well, are you getting lots of repeated conversations?
Yeah.
So people that you've spoken to maybe a couple of days ago.
Maybe if they've overdosed or if there's, suicide, the system will automatically turn those conversations.
It's an initial sort of intermittent sort of volunteering. It's now inspired you all to go down more professional route.
Yeah, and definitely at home as well. I mean, I have to stealth counsel my kids.
Likely to experience bullying if you are an LGBTQ teenager. Darker thoughts can creep in, and you look out in the world as quiet and you feel really alone.
But it's amazing to have a service there like this out there that it has, got all the after hours, and it shows, so we look at some of the data and how many calls are taking place.
What exactly?
Lovely to see you around.
Hello, this is Leo.
Hi, Leo. Cassie. Very nice to meet you. Very smart outfit. Hello. Very nice to meet you. So I just had a bit more of an insight, the latest data. I'm not sure, but you're good. Please, can you tell me your story yourself in your own words? Because I've read a little bit about it, and it's extraordinary what you did.
People aren't very comfortable about their mental health. So yeah, I decided to sleep outside because of skeleton as well.
Yeah, amazing. And how many nights did you sleep out?
365.
No way. I could not believe that when I read it. And I was like, rain, shine, sleet, snow. It snowed last year as well, didn't it? Yeah. And this wasn't in a tent, it was literally
It was in a hammock.
It was really, really inspiring what you've done. It's extraordinary sort of example to set for other young people. So I'm really, really glad you experienced.
Well, because I had my top, I couldn't really see the stars, but it was like really nice waking up when it was dark in the morning.